Welcome, everyone. We're just going to give a couple more minutes for the attendees to sign in. Welcome, everyone. I'm Julie Flannery, Senior Regional Resource Director for Caron Treatment Centers. Thank you for joining us for our presentation today entitled Compassion Fatigue and COVID-19, Prioritizing Clinicians' Needs in Surviving the Storm. We will be conducting our series in webinar format. All participant microphones will be muted. During the presentation, please utilize the Q&A feature to ask any questions you may have. Depending on the volume of questions, if we can't get to your question before the end of the hour, we will have someone from our team follow up with you directly. Today's presentation is eligible for 1.5 CEU credits from the American Psychological Association. We would like to thank our educational sponsor, CE Learning Systems, for their assistance in obtaining these credits. In order to receive your credits, you must stay on for the duration of the webinar. At the conclusion of the presentation, watch for an email from cego.com with a link to take the evaluation. Once you finish the evaluation, a certificate of completion will be available to download immediately. Today, we are prioritizing you, the helping professionals who have carried clients through the hardships that this pandemic has brought upon them. We will address the vicarious trauma that many clinicians are experiencing, help you identify when you're on the brink of burnout, and provide practical tools to help keep your emotional well-being in check. Now I'd like to welcome our speakers, who will provide their insight and expertise on these topics. Michael Blanche is a licensed clinical social worker with over 20 years experience providing direct clinical treatment to individuals duly diagnosed with addiction and other psychological issues. He has worked in all levels of care in the treatment of addiction and mental health. Michael provides middle school and high school prevention talks and staff development. Michael has extensive expertise in establishing and supervising residential and outpatient programs throughout the Philadelphia metropolitan area. He is the co-founder of Ethos Treatment, which provides intensive outpatient therapy at 3 separate locations in the greater Philadelphia region. Dr. Ramona Roberts is a staff psychologist and clinical supervisor of trauma services at Caron Treatment Centers. She treats and educates patients with trauma histories both individually and in group settings. Dr. Roberts has attained cognitive processing therapy provider status and received training in EMDR and trauma-focused expressive therapies. She has been trained by professionals in motivational interviewing network of trainers and has conducted several motivational interviewing trainings for clinicians and medical professionals in a variety of clinical settings and universities. Dr. Roberts has presented research at regional, national, and international conferences and has several publications in professional and peer-reviewed journals. She has also conducted trainings, lectures, and full semester courses on diversity training to better equip both clinicians and students growing in multicultural competence and sensitivity. Please welcome Michael Blanche and Dr. Ramona Roberts.
Hi, everybody. I'm going to go first, and I first want to thank everybody for taking time out of your Friday to come and participate in hopefully an engaging, thought-provoking piece. I'm really excited to co-present this presentation with Dr. Roberts and look forward to your feedback and your questions at the end. So first, again, thank you for everybody for taking time out of the day. Second, thanks to Caron, thanks to Julie and Caitlin and Dr. Roberts for putting this together, and Garth from our team at Ethos. we're really grateful to be working with Caron and the work that we've done, the work that we've been doing for those people that are participating. I know a lot of individual private practitioners and folks have reached out to me about this presentation today. Excited to hear it because this year has been a really complex year. This year has been probably the hardest when it comes to the substance abuse field and how the overdose numbers are dramatically above the alcohol epidemic, the misinformation marijuana epidemic, and so many different complications all intersecting at this COVID time. And our clients are isolated, alone, told to not to distance themselves from others, to not be connected to others. And at the core of recovery is connection. At the core of mental health recovery is connection and getting out of isolation, getting out. And so it's really been a challenging, complex time for us as therapists to hold that space. So I speak initially as a social worker, and my background as a social worker is my in-person environment perspective. That's the social work backdrop. And our in-person, the environment has dramatically shifted the past 12 months. Initially, it was a crisis. Initially, it was a storm. And initially, it was just one event. But now it's a changing tide of storm that's staying with us. And now we have to sustain and learn how to not just deal with the crisis, but now manage it and hold it for the long term in the maintenance phase of the storm and the anticipatory anxiety of what's to come and what is going to be next and how things are going to shape out next. So as therapists and in the attachment style that I hold true in the attachment work that we work with our clients, we have this holding environment. We hold a space for our clients. And it has gotten so much harder and so much more complex. So I start with just that vignette of understanding like my work as a clinician and the loss of that presence, of that ambiguous loss of presence. I deal with, and I don't know about you, but it feels so much more complex to reach out and connect to my clients. If I'm staring at a screen like I am in this moment, I'm staring at a dot. You know, I'm not staring at somebody's eyes. The oxytocin has lost a little bit of that connectiveness. And then when I am seeing clients in person, you know, we're sitting so far across from each other and wearing masks. I've met one individual that I'll tell you, I really like working with him. And halfway through working with him, he said, can we walk outside and so we could see each other's facial expressions? Because I've only met him wearing a mask. And so there's all these little subtleties that I'm going to kind of bring up that's impacted us, and the compassion fatigue, because I know we all got into this field to help others. I know we all got into this field to bring somebody to the closeness of recovery. And I know that we didn't get into this for millions. We got into this because we want to connect to our families and individuals that are struggling with substance abuse issues. So with that, I'm going to turn the presentation over to Dr. Roberts, and hopefully she'll take off with the PowerPoint presentation of her work, and I'm going to be kind of splicing through. So please help me welcome Dr. Roberts.
Thank you so much. You can hear me. Thumbs up, right? All right. Thank you. I'm really happy to be here with all of you. So excited to be a part of this presentation and for doing this with Michael here. I think he said that was all just well said, so fabulously stated, and I think something we can all relate to. I'm going to start really with talking about this collective trauma and how the pandemic falls into this term. Also, some other things that we've been going through in the past year that just kind of fall on top of the experience with the COVID pandemic. So there are long-term collective trauma effects that come as a result. There's a number of major events that people can witness or experience as a large group that can affect anything from how we think about things, how we feel about things, how we act, how we respond to things. And collective trauma has been used for events like wars, terrorism, economic disasters, natural disasters, mass violence, and yes, even pandemics. So this past year, a lot of people would say that we've included a couple of those things just mentioned, not just the pandemic. If we think about, a lot of events that have taken place in the past year as we cross over even the year mark with the COVID pandemic. So this type of trauma can affect entire communities, entire societies, nations, and, you know, in terms of the COVID pandemic, we're experiencing this as a worldly thing, right? So there have been a number of collective traumatic events in our history that have resulted in mental health issues, like an increase in suicide rates. We see the depression rates going up, anxiety, PTSD, general mental well-being is impacted. I think a lot of you can relate to at least that part of the statement, is the general mental well-being. And the impact of the collective trauma at the societal level can include a number of things, from national pride issues, increased individual and collective fear of what's to come, feelings of humiliation, identity crisis, feelings of vulnerability, which can create a lot of fear in and of itself, and heightened vigilance for new threats. So people in this pandemic really may be questioning their existence right now, what their futures look like on an individual level and as a societal level. And I hear this even in our clientele, you know, when they're talking about anxieties about the future and hopelessness and how they interrelate there. So we hear this term a lot, that, you know, we're weathering the same storm. And sure, you know, a lot could be said for that we're weathering the same storm. However, we're not all in that same boat in terms of access. And that could be access to resources to support pre-morbid status shifts the kind of boat you're in. And some of that is influenced by systemic issues. So, you know, even just to give a seed there of systemic issues, we could be talking about racism, cultural group issues, how the COVID pandemic is impacting certain groups more than others, age, a lot of that stuff can fall in there. So we do have collective memories as well that get passed down from one generation to the next. We have this, what we call transgenerational effect on future descendants and offspring and our children, right? So think about, you know, maybe someone who lived through the Great Depression, for example, and how that may have impacted their behaviors that then have passed to their children. Maybe it's their behaviors in spending, right? Financial planning. I can think about when my grandfather was alive, how he was never wanting to embrace the world of credit cards because of remembering his experience in the Great Depression and needing to hold on to that cash for some sense of security, right? So even some things around that regard, planning, you know, how you plan for things. We also see panic and grief and anger. Anger can be directed in so many directions. Anger could be directed at spirituality. Anger could be directed at a person. Anger could be directed at loved ones for getting sick, right? Anger could be directed at hospital staff. Anger could be directed at the president, right? It can go in so many different forms and directions, and hopelessness surfaces, and this can become chronic. So I did see in the Lancet journal in 2020, there was a rapid review of research published noting that the isolation and the quarantine in 2020 contributed to a number of negative psychological effects, including, again, that anger, PTSD, confusion. So we do see this in our patients here at Caron day in and day out as a contributing factor to their substance use, whether it's initial, like the initiation of the development of a substance use diagnosis, or its influence on a relapse in the patients that we have coming onto our relapse unit. When I do my psychological evaluations, time and time again, when I'm asking about what influenced their escalation or their relapse, I'm hearing COVID mentioned over and over, whether it be I got COVID or my loved one got COVID, or the isolation, the hopelessness, right? I'm not engaged in my regular routine and structure, and we'll talk about that a little more as well. Some people argue. I actually recently read another article around this, that there are some clinicians who are arguing that the pandemic being considered a reason for developing PTSD is muddying the waters and diminishing the true diagnosis, the diagnostic definition of PTSD as it is in the DSM-5. But there are a lot of people that are pushing back at that, reminding of the subjective variability in how we all experience different situations. So there may be someone who indeed endorses symptoms of PTSD with situations of that sudden loss. They lost a loved one to COVID. They didn't get to mourn them properly because of the social distancing, didn't get to say goodbyes at a hospital, that impact. Or maybe they themselves were hospitalized on a ventilator and it was a close call, they survived, but they have the symptoms as a result of that. But PTSD is not the only trauma diagnosis. If you look in the category of trauma and stressor-related disorders in the DSM, we have adjustment disorders. We've got that anxiety and that depression that go along with it as well. So I think it's important to, again, remember that subjectivity and be sure that we're looking at our clients and ourselves in terms of what's really happening for us, what's really happening for them, and not being pushed into either over-pathologizing or under-pathologizing, and really what's connecting to you or what's connecting to your client. In terms of the impact, COVID's impact being life-changing, and you can go to the next slide there, Caitlin. So COVID-19 has really forced us to explore, to question, and to understand how things are moving for us. But I want to go back to, I mentioned being in the same storm, but not necessarily in the same boat. And I'm going to let Mike here give some of his input to that. I think it's, such a great analogy that we use here for this.
And so that idea is that, and thanks so much, Dr. Roberts, that idea is that like we as clinicians are in the same storm with our clients a lot of times, and we have to acknowledge the transference, the counter-transference of understanding like we're in their community. We're told to work from home. We're told to get in line, to worry about a lot of different things that we're all worried about. Or the idea of, our clients are facing and hitting the same kind of roadblocks to growth as we are in some respects too. So just acknowledging the pain, the anxiety that we've held, about how we kind of manage. And so first, I would say that we as clinicians are in the same storm. However, one of the things Dr. Roberts said is everybody kind of got affected by the storm differently in the respect of two basic things. One is the environment of certain parts of our community, certain parts and pockets of our area felt the storm in a different way based on a lot of different resources. And so if you could go to the next slide, the idea is that, Caitlin, that we may not be in the same boat. And that idea is we have to know the boat is symbolic of the resources, and what are our resources? Some folks on this call are working in a community like Ethos or Caron, where we do group supervision and individual supervision. And so we have a community of therapists that we talk, if not daily, often about the struggles and the learning process. When we pivoted to telehealth back in March, the state of Pennsylvania, DDAP, didn't have regulations to do it. We just kind of flew blind. We did what we felt was good for our clinician and our right for our staff and our safety for our staff. So we flew blind into this. And again, it was like, I don't know about you guys as clinicians, but we kind of were flying an airplane as we learned how to fly the airplane, as we learned the rules of the road. And then, we had to also take care of our own home and take care of our own lives. And some people are single parents. Some people have dogs or cats that interrupt, Zoom sessions, and in all sincerity, when we're doing our work, it's so complex to realize that we have to really be focused in our own self-care. And that same boat in our boat is our resources. So if you are a practitioner in private practice, my hope is that you've reached out to other practitioners and gotten into group supervision. If not, please do, because I really want to make sure that you're involved in a community and the connectiveness, So that is where you're involved in a community to connect this, so you don't have to face this alone. We want to mirror and model healthy, practice for our clinician or for our clients. We want to be a model of healthy direction in that respect, if that makes sense. So we're not all in the same boat. We have to know our resources and we have to get a bigger boat. And that idea is like, how do we expand our support network? How do we expand, our resources? And it literally this year has really challenged me as a clinician and the supervision I provide is to make sure that I'm literally reaching out to more and more clinicians, FaceTiming sessions with other clinicians, Zoom meetings with other clinicians, and I'm promoting and pressuring, not pressuring, but I'm telling our clinicians that they got to put self-care as a priority because we don't know how this is going to roll out, how this is going to go. So when it comes to the outpatient clinician, staring at a screen all day long and feeling a little isolated, I'm telling clinicians to meet up and walk every now and then together, socially distant, and making sure that they're connecting to other people as best they can so they don't feel alone and isolated in the work. So now I can turn it back to Dr. Roberts. I know she was kind of jumping through and I wanted to slow her down, so I appreciate that. So right back to you.
I love how you said, Mike, we need a bigger boat. Right? We need a bigger boat. We need a sturdier boat. And sometimes as clinicians, even all of us on here, we are patching the holes in the boat as we are moving, right? As we're going forward. So, if we could just like hold this analogy in our minds, right? That we are experiencing a lot of similar things as the clients that we work with. And sometimes we have to take our own medicine, right? So. All right. So in terms of COVID's impact, we definitely see an impact on trust because we're unsure of who to trust now in terms of that vulnerability, that fear. Maybe it's as simple as trusting rules, right? The socially distanced rules, mask wearing. I'm sure some of you in here have been in places where someone hasn't had a mask on, or maybe someone in here hasn't had a mask on at some point, and there's a struggle with that. But orders and restrictions and trusting in the science, and that trusting that someone out there has your personal best interest at heart. So it has shifted so many things for us in terms of what school looks like, what work looks like. Those of you that have children at home doing virtual schooling, or maybe it's hybrid, what work looks like for you, as Michael already pointed out, going virtual and having the teleconference things just kind of dropped in your lap, right? What threat and danger look like, our understanding of society and other people. So if we think about many of you may recall learning this in your early lifespan class or an intro psych, is learning about Erik Erikson really posing to us that we develop a sense of trust when? In that first year of life, right? And that is so fundamental to where we go as adults. And as infants, it comes out of the experience of trusting people around us, trusting that the world is generally a safe place and a predictable place. And he found it to be so fundamental to our continued existence. And out of that development of trust, we obtain a sense of hope and optimism. And the key event at that phase of life is feeding, right? And we'll see this come full circle. So if we think about that basic need for nourishment, and a pandemic like this serves to disrupt this existence of hope and predictability, right? We have so much uncertainty out there right now. And this predictability of our world on so many levels, and coming back full circle, even to that aspect of feeding. Think of how many people who are now faced with the uncertainty of where their food is coming from. And think of the lines at the food banks and the churches and the shelters and things like that. And some of you may have found yourself in that same situation. So it really disrupts, that hope and that optimism. It disrupts our plans for the future, our dreams, vacation plans that we had, family plans, right? Holidays, maybe some rites of passage, and milestones. So think of how many students have graduated from high school or college and couldn't have that celebration. We see these things that are really sweet when you see, a family has put up a stage outside for their daughter and for the two of them to, sit in a driveway in seats. I saw something like that. We saw a number of things like that, right? There were people trying to be creative and still finding ways to honor things. Weddings, funerals, right? Where family get together and celebrate. But the goals even that we have for our futures, maybe starting a new job, starting a new practice for some of you, a new business of some sort. So it really has hampered our sense of mission and pursuit and goals that really give us strength and motivation to keep living our lives. It's really like commandeered our place in the world as it's taken away things from us, like our favorite hobbies, interests, restaurants, jobs, and things like that. It's stolen our physical contact. So Michael mentioned oxytocin earlier. Think of the lack of that release that we've all experienced over the past year, and not being able to physically touch someone outside of your home environment, not being able to hug someone when you see them, having to do that, fist pump when you're socially distanced. Those individuals help us feel a sense of belonging, and they help us feel a sense of love. I can remember reading an article very early on in the pandemic that said we may need to just hug ourselves, that we can try to contrive this experience, and that at times it can be effective, but trying to be very intentional about getting that physical release as well. With being unable to be physically close to our loved ones and maybe losing loved ones and not being able to honor their lives with certain traditional ceremonies and rituals and memorializing and honoring and things like that, we've lost the basic yet really significant touch points socially that liven up our days and give us a sense or some semblance of confidence that we matter to people and that we matter to this world, right?
Jump
go
in
ahead, Mike.
one second. I just want to add to that ambiguous loss that I talked of earlier, and the absence of presence of all those things you talked about is traumatic. And again, I agree with that, questioning what kind of language we use about trauma, but just using that as a clinical framework to respectfully say, like, we've lost so many of those individual touch points of those connectiveness, and that ambiguous loss, the absence of presence of people's presence in our life, the shoulder to shoulder rub, the running into somebody in a hallway, the water cooler at a job site, all these little subtle nuances that we miss in our day-to-day existence, we just want to acknowledge. So I just wanted to add that in there. Thank you.
Absolutely. So important. And for some people, the emotions that people are experiencing through this pandemic are more than just a reaction to today's troubling times. So is this really the pandemic, or could it be something underneath? And many people are actually experiencing trauma for the very first time during this pandemic. It's their first experience with something like this. Maybe not their first time with adverse experiences in general, stress, things like that, but their first that they would maybe identify as traumatic. But some people, their anxiety and their fear are rooted in what we call like an unresolved past trauma. Or maybe it's another current trauma that's not the pandemic, that the pandemic is taking a role of triggering for them, because maybe it connects to them in some way of just that loss, that extreme circumstance, that lack of control. So people experiencing a trauma response, meaning they've had past experiences with trauma, and this is serving to kind of like poke at that. So we'll call like a trauma response, how they're responding to this, but not because it's the pandemic, because they have something underneath that. They often have difficulties in the areas of intimacy, trust, power and control, self-esteem, and safety, right? And that can be physical safety, and that can be emotional safety. So in the pandemic, many of us had our sense of power and control really ripped from us, right? With, again, all of that uncertainty. And it has affected the way we parent, the way we shop, the groceries we purchase, how we approach, that financial spending, again, planning, how we connect with family and friends. But those who are experiencing the pandemic as stress are typically capable of shifting gears to other thoughts and easily finding activities where they can forget some of their concerns or even find a way to relax throughout the process in the midst of the pandemic, not diminishing that this pandemic still has an impact on them, but they're able to find a way to shift gears a bit. They may display some worry and irritability, but to some degree they can maintain a feeling of control in their lives. However, for other individuals, the pandemic may trigger adverse events or feelings from their past. For example, if a person experienced a sexual assault at some point, the feelings around trust, control, self-esteem, and safety can be brought up by the pandemic and can contribute to a more intense experience of powerlessness. I can think about a recent experience with a client that is struggling, no other symptom endorsement, but of a trauma diagnosis, but is struggling with the mask wearing because it reminds them of when their mouth was covered during their sexual abuse. And so again, this may be, the pandemic may be serving as a way of like poking at those previous trauma experiences. And I think we need to take this into consideration, and the concepts of the actor-observer bias and the fundamental attribution error. These are social psychology terms you might remember from a previous class, but when interacting with others, I think it's really important for us to come back to. So we've got some images here for you, some comments, so let you read them. And so here's a child turning in an assignment. The professor or the teacher saying, "So late, lazy bum." Or we have situational attribution, "So late, maybe a family issue." So this is your fundamental attribution error, where we tend to underestimate the external factors, the things going on in the world, the pandemic, right, and how that's impacting people. And we overestimate or overattribute it to their internal disposition, who they are at their core, right, what their values and characteristics are. I see this all over the place. So outside of my role at Caron, I'm also in a professor role. And I see this with my students in this very image, where I have students emailing me late work, and I have to be mindful myself that I'm really considering the potential situational factors at play. I had students who had caught COVID themselves, right, who needed more time to turn in their work. Or maybe this is just creating so much stress. They've got kids doing virtual learning, and I've got adult students in college classes, and they're trying to navigate all these roles, and they see this impacting their work. Go ahead, Mike.
So I appreciate that. I just want to sneak in this one idea. I would say it a little bit differently, this idea of the cognitive schema approach and understanding, like, we both wear glasses, and that idea is like, now this filter that we're filtering our world through COVID eyes, which are, we're stressed, we're run down. We've got to be conscious of how we're taking care of ourselves every day as clinicians to see how our confirmation bias or what we're looking at and how we're seeing the client in perspective, or student or family member, and not quick to judgment, but to pause. Every day I'm seeing it as well in my practice, that in our work in Ethos, we're all seeing this confirmation bias. All of our clinicians are telling our clients, we're sending everybody home with an extra pause button, an extra patience button, an extra moment of reflection before jumping to conclusion. Every day I'm recommending the 4 agreements as an intervention for clients and families to read together. At least once a week, I'm telling a couple to read the 4 agreements together, to slow down, to pause, and not jump to that assumption or jump to that quick solution. So I just wanted to add that in real quick.
Yeah, and I love, actually, you brought up a term I wasn't thinking of bringing up here, but you mentioned the confirmation bias. And if I could add an example to that here, and any of you could steal this in groups that you may run, but in I'm a big fan of social psychology. It's one of my favorite courses to teach, and I find a way to insert it into clinical work. And when I'm running groups right now, I have a group that I do specifically on emotional wellness and finding positivity in the midst of COVID. Because right now they're living the pandemic, even though they're here in treatment, and they're going to be discharged to still experiencing the pandemic. And so we're talking in that group a lot about things like gratitude, shifting your frame of reference, the lenses that you look through, right, Mike? Absolutely. And one of the things I do with them is just a very quick experiential exercise where I find a great spot for it in the group where I see, they're all kind of leaning towards this one direction. And I say, humor me for a moment. I need you to look around the room and recognize and say in your mind all the things with the color black. Say it in their mind, not out loud, okay? So obviously I've picked a color that I know there's a lot of in the room, and I've got to be really intentional that I pick my next color based on not having a whole lot that's really obvious to them. Sometimes I pick red because my glasses are red, and I often have something else in the room red with me. So I ask them to name all the things that are black in the room. Look around the room. I give them about 15 seconds because I don't want them to analyze everything. And I then ask them if they're comfortable to close their eyes. I do say that if they're comfortable, because some people might, that might trigger them. So I ask them if they're comfortable, close their eyes. And now, while their eyes are closed, say those things that are black again, 1 or 2 more times in their head, like play them again. And then I say, now, with your eyes closed, I want you to tell me out loud all the things you saw with the color red. And I often get them saying something that's black, the TV, the remote, my sneaker, and I need red. And then they start saying things, and I say, you can open your eyes now. But you asked for black. And I asked them, why couldn't you name the things that were red? And they all start to get it. And they say, well, because you asked us to look for the things that were black, so we weren't looking for red. Right. What does that mean in terms of application to everything we've been talking about? If you think people can't be trusted, right, the world's a dangerous place, you're only looking for the things that confirm it. People can't be trusted, then I'm only finding all the black, right? I'm finding the time I lent Mike money and he didn't give it back. Don't worry, it's not true. I'm finding the time that, Julie disclosed my secret to Caitlin. I'm finding all the times that confirm I can't trust people. What I'm missing is the time that Caitlin really held my words in confidence. The time that what my mechanic said about my car was actually accurate and he didn't take me, I'm thinking about the time that, someone was there for support or, so I'm missing the others, and I've got that confirmation bias, which is just tunnel vision. And so I now start to encourage them to open their tunnel walls and start looking for the red and the pink and the green. And we need to do that ourselves, right? We need to do the same things we're encouraging our clients to do. Go ahead, Mike.
I could take that 2 steps forward. I was going to end on this, but I'll just interject this part vignette is this idea of our clients are persons in recovery, and people in recovery, the language of recovery that I'll use is a faith concept. And, do we want to feed the fear or do we want to feed the faith? And there's 2 different types of faith. There's a blind faith sometimes, and then there's a working faith. And I ask people to look back in their working life history to see, people have gotten sober, people are staying sober in the pandemic, people are actually getting to treatment, and people are really getting over this substance abuse and mental health issue and facing life on life's terms. So that faith and that trust that they actually can get well, stay well. So looking for the successes. And somebody asked, Adam Lush from Caron asked, how to help with that, help focus the energy and the focus of how our clinicians look for the positive outcomes that people are getting sober and are staying connected. So I wanted to add that in, and I'll follow up later on the end. Let's try to get back to the slide so we get through that and get to more of the solution toward the end.
Yeah, the next image, again, very similar, it's a social psych term. Here's your actor-observer effect when turning to situational factors when it comes to your own behavior, but targeting someone else's character when it comes to theirs. So people are so inconsiderate when someone else litters. But if it's you that's littering, but there's no dustbin, right? So how are we reading people's behaviors? How are we reading other people's behaviors? That's in our family, in our friends, in our coworkers, in our bosses. Because again, if we think we're all in this same storm, right? What are the boats that people are in, and how might that be showing up in their daily interactions with you? And this is important for us to remember in the way we treat our clientele, right? That we, again, before we over-pathologize, we try to use that empathy chip and think about these external contributors, right? So seeing beyond the surface and taking into account the disruptions going on in everyone's lives right now, right? So what does this mean for our clients and for us? Michael already mentioned a bit about the Zoom fatigue issue. So Zoom fatigue has been a term used this past year for the overuse of video conferencing and the consequences that follow. This is a challenge for clinicians in both our own personal experience of it and the delivery of it to clients. So when you're sitting behind your screen delivering a service to your client, you're experiencing very much the same issues of Zoom fatigue as that client can be, especially if your role is to be on Zoom sessions all day long. Maybe it's not clinical sessions all day long. Maybe you're in a role we have meetings all day long. I'm on WebEx throughout the whole week, doing virtual meetings to try and stay socially distanced. So there are health issues that come with this screen time that can include aches and pains see where you're sitting right now at the screen, your back, your neck, your shoulders, right? Tired eyes even. So I have spoken with optometrists and got some anecdotal info there. With my own experience of bringing my son during his virtual schooling experience to the optometrist because of continued headaches. And I hear from the doctors there that they are seeing a real increase in appointments because of people having headaches and wondering, is this a visual thing? Do I need new glasses or do I need glasses? And luckily, both for him and myself, we got the glasses that have the blue light protector on it. And I can tell you for both of us, it has shifted the amount of headaches and migraine experiences that could be debilitating. You can have headaches that can last for days because you're on the Zoom every single day. So, just another health impact of the increased screen time. But virtual platforms are not just being utilized, again, by students, as you know, in your work. How many of you right now, if you could think about working from home, utilizing Zoom, Google Meet, WebEx, you name it, there was a clinical psychologist, Dr. Brenda Widerhold. I'm going to read a comment that she gave about communicating over virtual platforms not being, in fact, real time. And here's what she said. Our brains are used to pick up body language and other cues, not to mention increases of dopamine that are experienced during face-to-face communication. On a video call, something is off, and our subconscious brain is reacting to it. Communication isn't in real time, even though we may think it is. Great comment from her, and this is in reference to the lag time we also have, even a millisecond delay that can trigger the brain to look for ways to overcome that lack of synchrony, leaving your eyes to then fatigue and have us feeling tired and anxious and worried, right? All from Zoom. You find a little more anxiety in your life, may not just be the COVID pandemic, because of that uncertainty of your health, but it could be the impact of all these other directions, your Zoom experience, your virtual, I don't want to just give it to Zoom, but your virtual platform that you're working on. So in social interaction, we rely heavily on nonverbal cues, micro expressions, body language that are more evident in the in-person clinical setting, classrooms, things like that. And you may remember from maybe a multicultural class at some point you've taken that only 30 to 40% of our communication is verbal. What does that mean? The large majority of our communication is from those nonverbal things that we're missing. Sure, right now you can see I'm talking with my hands, and that's just me, but you're missing a lot of other things. You don't get to see this up close, maybe an eye expression I give or some other affect, or just a body leaning in differently or leaning out, things that you would normally read from your clients and that they would read from you. I have found I've had to be much more intentional when I'm doing a virtual session with a client about trying to express my end of the situation, right? How I am taking in what they're giving me to help them notice that I'm there with them, that I'm validating them, even with just a look or a body expression or gesture. Sometimes I'm actually very intentional about raising my arms up, right, as I'm using my hands, because if I talk at the normal level, you can't see them right now, but that's my normal level for hands. So here I am thinking, move them up, right, so they see my action. Another issue with the framed face on the screen and not getting the rest of the nonverbal cues is the person can appear rather large. And on that monitor, in that large size there, that can ignite that fight or flight response in people that maybe do have a trauma history. And even for those that don't necessarily, it can still trigger that cortisol to flow and rev up your stress response. Every time we get into this activation, our sympathetic nervous system is the gas, right? Sympathetic is the gas and the parasympathetic is the brake. We need that parasympathetic system to now get activated to pump the brakes. So think about this constant or this frequent experience going back and forth as a result of extreme and prolonged stress. And we can sum up 2020 as extreme and prolonged stress, right? Now going into 2021. It can leave us with a diminished ability to perform at our typical capacity. And aside from physical and mental health symptoms, it can leave us disinterested in our work. Anyone ring a bell? Feeling disinterested with your work and wondering like, hey, I used to really enjoy my job, and wondering where that's coming from. Maybe feeling restless, tense, forgetful, having concentration difficulties. So all of that is happening to our clients, and how many of you can relate as clinicians, right? So think about how all of this is happening to you. And I love how Mike stated earlier about taking the walk. So I think it's very important to be conscious, again, of putting the effort into these little pieces that you can do. And we'll mention, again, we'll keep mentioning a few of these other pieces that you can add in. But in terms of, you know, the getting disinterested in the work and just feeling like you're on these platforms all day, making sure that you really demarcate where does work and home separate, especially for all of those of you that are working from home. And we see a lot of maladaptive behaviors that can result from all of the things just mentioned that's happening with our brains here. Self-injury, maladaptive behavior, right? We've got the substance use, acting out, withdrawing because maybe they have a lack of resources. And Mike, I know you want to add a bit here.
No, and no, to that point, that idea is that, again, we're in the storm with our clients. Our clients are coming into our offices, are coming in virtually to our offices, talking about, you know, where does work end? You know, so many of the feedback that I get from our folks in the home setting is they're not done. There's not a definitive timeline of the beginning or end of a day. And that's one of the huge signs for our clients' burnout and ourselves, you know, and I'm getting emails from staff sometimes late at night and I'm giving them feedback. Hey, wait a second. We got to have a regulation of how many hours we're actually given to the work front. And so many say, well, I didn't really have that many hours during the day. I was worried about my kids' schoolwork, so I'm giving it at night. But there's got to be some better boundaries around time frame. And to your point, there were 2 or 3 points I want to recap this piece. The one you talked about, the space, the literal space. So recently I've been coming in. I'm actually in my office in Westchester. I'm coming into the space, even though I'm only seeing 1 or 2 clients a week. But coming in, that line of demarcation has been really helpful for me. Early on in the pandemic, my wife made fun of me, but I would get up every day. I would get dressed to the shoes and everything in between, and I would get on and be prepared to see a client, even though they were only seeing me in this format. And I had to play with the format. I had to build a standing desk at one point because sitting was different. So I'm sitting today, but my hip, I got really bizarrely jacked up with my hips because of sitting differently, sitting on a Zoom session versus sitting back. When I'm sitting in a therapy session, sometimes I sit, and given that space, again, that object relation space for our clients to feel that they can participate in the experience of therapy. And so again, it's that subtle shift sometimes of being able to step back and literally, or how I'm positioning affects my body and how I take care of myself. So in that respect, you know, I get a lot of feedback from clients as well as staff about when they're mirroring and they're looking at themselves, saying, what do they look like, and that self-image and image management as well. They get really concerned around body image and how they look. And you said some of our folks that are preoccupied with body image, they get really consumed with it when they're on work all day long in the Zoom setting. And again, that affects self-esteem, and that can be a huge trigger. And that can be really effective and reflective on how they look at themselves. A couple of people are adding in that Hugh talked about having to go to a chiropractor themselves. And I agree, I've had to go to a chiropractor myself just because of that hip action as well. So when it comes to, the pandemic and how it's affected us body-wise, I think you have a great slide coming up in a couple of bits. So I'll turn it back to you on the burnout piece.
Thanks, Mike. Yeah. So it's important that we not confuse vicarious trauma with burnout, right? Sometimes we hear them used interchangeably, but they're actually a bit different. Burnout is generally something that happens over time, and a change such as a time off or a new job can take care of burnout or improve it. Exhaustion is caused by a person facing a stressor, right? The body's reacting to the stressor by releasing the hormones and the chemicals needed from the brain. And then the body either repairs the damage done during the alarm stage, or the stressor still exists and the body goes into that exhaustion phase. Some signs of burnout are difficulty managing emotions. Maybe some of you have noticed that. Maybe you're getting snippy with your loved ones in the house, just finding a little more irritability. Maybe you're finding it hard to make good decisions, problems managing some healthy boundaries, such as taking on too much responsibility, boundaries even with you and your clients, or feeling the need to respond to people at work. Maybe physical ailments, again, the aches and pains, illness, accidents, difficulty feeling connected to what's going on around and within you. Some people are just feeling disconnected with themselves, right? The loss of meaning and hope for the world, and difficulty separating clients' experiences from your own experiences. Some of that can be seen in the burnout, right? But vicarious trauma, however, is a state of tension and preoccupation of the stories and the trauma experiences described by your clients. This tension and preoccupation might be experienced by counselors in several ways, counselors, psychologists, any type of clinician you are out here in the audience. A person experiencing vicarious trauma may avoid talking or thinking about how the trauma affected the client. So we see a lot of clients that go into avoidance mode. That has become their coping skill. That is a big focus we have in treatment here at Caron, is talking about avoidance. And really, just because you bury something doesn't make it dead. The longer you avoid, the longer it hangs around, right? And we help a lot of our clients and patients see that. But maybe you lose sight of what the client had been talking about. You find yourself mid-session like, oh, shoot. It sounded like they said something important, and now I look like an idiot if I ask them to repeat it, but I got to find a way to try and get them to repeat it because I'm lost somewhere in my own uncertainty or stress and so on. And maybe feeling numb about the traumatic event. So the clinician also can be in their own persistent state of arousal. And vicarious trauma, very similar to when some of you may have heard the term that PTSD is a normal response to an abnormal situation. We've heard that line probably a number of places. Vicarious trauma is normal and is in the process of change that happens because you care about the people you serve. So the important part is that you can recognize it and you have that good supervision again and those resources, and maybe it's your own therapy, that you work through that so it doesn't impact your client and it doesn't impact you any longer in that way. But I say that line just to help you not have your own, like shame and I must suck as a clinician because I'm being impacted by their trauma stories. And I can tell you, as supervisor of trauma services here, I've heard, the spectrum of trauma experiences outside of pandemic and inside pandemic. And I have to be very mindful of the self-care that Mike mentioned already that I'm practicing. So again, that vicarious trauma can just be understood as an experience that happens because you are getting that repeated exposure over and over. And especially, again, in the pandemic, some of you may not specifically treat trauma. That may not be your forte, but you're hearing trauma stories because of the pandemic. So you may find yourself working anywhere else, addiction, you may specialize eating disorders, you may specialize in depression, anxiety, you may specialize in personality, whatever it is, it may not be specifically trauma treatment, but now you're kind of thrust into this world of, oh my gosh, I'm hearing trauma stories all the time, and what do you do with that, right? So again, that self-care really comes in. Continuing with some of the vicarious trauma, on the next slide, you're going to see some symptoms here. So someone who's experienced vicarious trauma can be experiencing any or all of these symptoms, and even some that may not be on the slide. Sleep disturbance, hypervigilance, pervasive hopelessness, self-doubt, inability to concentrate, disorientation, forgetfulness, isolation, right? Apathy, having an emotional roller coaster as it feels, loss of purpose, anxiety, change in appetites, there's a number. So some symptoms of vicarious trauma can be what you see in your own clients with PTSD, that hyperarousal, nightmares, difficulty concentrating, right, being easily startled, and a helper in any of your roles, social work, therapist, counselor, psychologist, can experience repeated thoughts or images regarding the traumatic event, can feel numb, can feel unable themselves to tolerate strong emotions, can begin experiencing guilt regarding their own survival, disgust towards others, fears surrounding the traumatic event. Some behavioral and relationship signs of vicarious trauma, feeling like you never have time or energy for yourself. So I think boundaries was mentioned at some point in here. Feeling disconnected from loved ones, even when you're communicating with them, right? So we have social media that is meant to bring us together and to socially connect us, but we've lost something in that. Again, going back to Michael's earlier point, but we can feel disconnected even if we are still making these efforts to communicate. We might have increased conflict in relationships. Some of you, whether you're working from home or you still go to work, may find yourselves in your household with your significant other, your kids, and just, again, finding yourself reacting to things a different way, wanting more of your own physical space, not wanting to kind of socialize in the family at home, finding yourself going home later, a number of things. A colleague of mine the other day, I loved her line. She said, I can be replaced here at work. I can't be replaced at home. And, her load is full like everyone else's right now, and finding the boundaries for self and really, I think, grappling with where do I find that, I'm caring for the people around me and my clients and so on, but I'm putting myself first. The same thing I would say to you all struggling with that is what I say to clients, is that boundaries is really about caring for yourself and caring for others. You have boundaries because you do care about other people. Because if you don't set those boundaries in your relationships with other people, you're a yes-sayer all the time, right? You bend over backwards for things they need. You're always meeting their needs, responding to them on their time, whatever that may be, whatever that might look like in your life. Eventually, what happens? Some of you might say, well, resentment and bitterness starts to bubble up under the surface, or, so you start to lose yourself in the process. And if you're losing yourself, what are you really giving to those other people? Are you really giving that client, for example, all of you as a clinician, the effective clinician that you were trained to be, that you know you are? Are you really giving that to them anymore? So boundaries are important, and we could stop looking at it as needing to have guilt in a selfish respect of like, I want to take care of me. But in taking care of me, I'm also taking care of other people. So seeing it that way, again, kind of shifting those lenses that we're wearing, right? Maybe, go ahead, Mike.
I was going to jump to the next slide, if that's okay, about knowing the resources, but I don't want to jump you if you wanted to finish this.
No, go ahead, jump to the next one.
So this idea of knowing how important self-care is. So this idea that, yourself and how you are as a clinician. One of the comments that was made, and I just wanted to bring it up from the chat, was some of these difficult decisions we have to make as clinicians to how we take care of ourselves, and to not, and to your simple word, you said, to not feel guilt or shame about your decision to keep in telehealth, for instance, where there's some places, some people are putting a little bit of pressure to go back in person, and some people are worried about their own health or worried about their own safety and well-being. And so I can't stress enough that importance of self-care. And that's why I wanted to jump to this, because I want to get to more protective factors toward the end and solutions for everybody at the end. So if you want to jump back to this, that'd be great.
Yeah, absolutely. Yeah, we can keep going. So I think if let's move to the next slide. Let's not you.
Yes.
You take this.
Sorry. So even in our process, to be completely transparent, and a model for our folks that are watching us today, we had stressed to kind of put this all together. You know what I mean? There's so much information, and part of the protective planning and part of the work that we have to do as clinicians is to know the language, understand the language. And I appreciate it, Dr. Roberts, your deep descriptions of the language, so we as clinicians can wrap our heads around it. So the first awareness piece of knowing your resourcing and knowing the protective planning is literally knowing your self-care. And the importance of self-care is knowing the language of what are kind of bombshells that we have to walk through every day. And so in this protective planning and knowing your resources, you've already mentioned a couple in that self-care, the word boundary you talked about, but how we're taking care of ourselves. And so I want to start with a simple one of literally a self-inventory every day of your own recovery needs, your own individual needs, as most clinicians have to take care of themselves. So when it comes to, most of you saw me throughout today's lecture, I'm drinking a ton of water. I am more dehydrated from staring at a screen like none other. I'm staring at a little screen. And so like literally hydration, physical self-care, and everything related to your own individual nutritional needs, sleep. How many people in here at the beginning of the pandemic had nightmares, had difficulty because of they would see flashes at night from staring at the screen? There was a huge adjustment. All our clinicians were talking about in that first couple months of the adjustment of staring at a screen all day long. Now we're used to it, but we have to really know, just because we're used to it doesn't mean it's okay. Just because we're sustaining this doesn't mean it's okay. We have to punch through and do more protective planning around our work, because again, we don't know how this is going to progress. We don't know what's going to come, but if we know our own resources and know what's around us that we can reach out to and talk about the stress and talk about the vicarious trauma versus burnout, and not be afraid. Again, one of the things I'm doing in a couple of weeks is I'm taking a vacation. And I had a little regret or a little insecurity by telling a client that, was planning out their next session. I'm like, I'm going to take a vacation. And you should have seen the client's eyes. They were like, that's awesome. And to hear a client say, that's great. Where are you going? What are you doing? Because they want me to be well. Because if I'm well, they know I'm going to be a better clinician. If I stop and eat, or if I stop and take care of myself, like you talked about, if I'm getting sleep and if I'm creating time for myself, then I'm a more effective clinician, more effective supervisor, and I'm more present for this moment. And every time I'm burnt out, or every time I'm holding the client's trauma in a way that's uncomfortable for me, I have to listen to my body, listen to that sensation, and work on it. So if it's self-care pieces, that we can move to the next pieces around the protective factors and the next slide. That idea is knowing how your work is meaningful, and knowing what kind of impact we have on our meaningful work, and knowing our clients and the importance of our own self-care. And a note, I have a lot of clinicians that are people in recovery. And so after staring at a screen all day long of doing telehealth work, the last thing they want to do is sit on another hour of a traditional 12-step meeting that's on Zoom. But I'm telling our folks to change up that position, by the way, of literally where their camera is, their laptops are set up for work, and to change that position, take it somewhere else, even have that subtle shift, that subtle change up, so that they can have their own recovery, to see that recovery and seeing people stay clean, sober a long time. So do you want to take it back to the pieces that you wanted to mention about the protective factors and that other
Sure.
piece?
Yeah, so the protective factors here, and this comes from the research that's out there that shows, some influences that help us not go on to develop, let's say, a PTSD diagnosis or have those symptom endorsements. And there's a number of factors that they list. The first one being continuous contact with and support from important people in your life. We've mentioned that a few times in here, right? I see it even being mentioned in the chat. In the pandemic with the social distancing, we may need to be more creative, more intentional, more effortful in that contact and what that looks like. Identifying as a survivor rather than using the victim term, disclosing the trauma to loved ones, use of positive emotion and laughter. I talk about that in the emotional well groups as well. Being very intentional about maybe you watch a funny YouTube clip. There's some days, the other day, my son, who's 15, gave me this comedian clip to watch, and I hadn't watched it yet, and I was having one of those days. I mean, I was being pulled from all ends, drained, and I was taking, a few minutes to sit down and eat my lunch, and I said, I need a laugh. And I pulled up the YouTube clip, and man, I burst into laughter for like 10 minutes. I got to sit with my food and just laugh. And wow, did it help like re-energize. It was like I went to the gas tank, or I went to the gas station and put some gas in my tank, right? So definitely use of positive emotion and laughter. Finding positive meaning in the trauma, helping others in their healing process, and really holding to the belief that you can manage your feelings and you can cope with the situation. Again, the lens you look through, and sometimes you have to be really intentional about switching up that language you use with yourself. There's also an experience of what we call post-traumatic growth. It's less referenced than PTSD. People see a lot more about PTSD than they see about post-traumatic growth. But that has to do with maintaining a sense of hope about surviving through the trauma, not having to be passive victims, and that the person can have positive personality and life changes happen as a result. To help facilitate this growth, someone needs to see the importance of embracing or leaning into their experience of pain rather than trying to reject or avoid it. And that's common in mindfulness practice. Those of you that engage in that yourselves, aside from what you encourage with your clients, notice that doesn't mean being okay with it, right? Acceptance in mindfulness isn't approval. It means accepting something for what it is. So struggling with reality is wasted struggle. If you ruminate over, why something has to be the way it is that happened 6 months ago, it's never in your past. It's still going to be in your present because you're constantly trying to fight with the fact that it actually exists. When we can accept that something just exists, we can learn how to move forward from it and find other ways of going beyond that. Meaning is really important, making meaning in and across our lives. Gratitude falls here in this area. And this is, again, one thing that we cover in that emotional wellness group I was talking about in terms of finding that in the midst of COVID. Gratitude has been backed by a number of research studies to help with a number of things. Those of you that struggle with sleep at night, gratitude exercises before you go to bed. You're ruminating over all the uncertainty about where your job stands and where your kid's school stands and where your food is coming from. In that moment, recognizing that I'm not going to solve this problem right now in this moment. So let me lay that aside and find some gratitude in the experience, right? Finding some meaning. And this gratitude doesn't have to be monumental. I always tell the patients here, maybe it's something as simple as your lunch tasted good today. It doesn't have to be monumental gratitude. But what I encourage is that at nighttime, and for some people morning time, to find gratitude about one experience, so something that happened, and then a second one of something that's internal. So maybe my gratitude experience of the day is that Mike was there for me to support me when I needed him, and I'm really grateful for that. And maybe the thing internally is that I had some perseverance today. I pushed through, or I had some courage today to face a situation that I would have normally been afraid to, something like that. So something that's external and something that's internal. Go ahead, Mike.
No, and that gets back to that strengths perspective. As we are trying to sustain all these tides of the storm, we really want to look at that internal self-reflection skill. And that idea is that, like, how you talk to yourself as a clinician, how you talk to each other as coworkers in a cohort, coming from a place of forgiveness, coming from a place of empathy, coming from a place of love, in that respect, that we are caring for each other. We're in a caring community that's looking to collaborate, and collaboration is critical at this time to work together as individuals trying to help each other kind of through this process and the model behavior for the recovery community coming in. And so coming at this as a way to make meaning of relationship builds that you have in the community. And as an outpatient clinician, you know, one of my biggest recent stories was a local private practitioner reaching out to me to tell me how to get the vaccine, for instance. And he didn't have to take the time to call me and reach out to me and tell me exactly how to get it, but he did. And I haven't worked with him in a long time. We haven't spoken in a while, but that meant clearly a lot to me. But then, you know, what I had experienced was that internal guilt of getting the shot before some people in my life or other people in my world. And some of my clinicians have even felt guilty because they got it before their loved one or their parent that they're really worried about as well. So again, when it comes to the collective and collaboration work that we do and learning from each other, I want to jump to that next slide around, you know, this idea of resourcing and reconfiguring. Resourcing is so important in our work and our recovery, is rapidly reconfiguring our resources. Actually, can you jump 2 down real quick? Is this idea is like knowing who's available, what's available to connect to each other. And so, yes, it's a continuing education year. Yes, we all had to get our hours in. But I don't know about you, but I've enjoyed learning a lot. And so when we talk about self-care, we talk about what does that actually practically mean? Let me kind of take 5 minutes into this idea and to look at, you know, educating ourselves. And I don't know how many of our clinicians within Ethos system have shared different TED Talks with each other, different snippets from YouTube videos, different education, not just continuing education for our clinical hours that we have to check the box, but really fun, inviting stuff so that we can really share with our clients. And we've gotten creative in Zoom land in our groups that our clients are now, you know, shared screens, sharing different images, sharing different quick videos. And because of technology, you know, we're really able to utilize technology in a better way to have group text going around as clinicians, to group text going around with our clients to make sure that they have up-to-date information and understanding about changes of password changes to Zoom links to traditional 12-step meetings or smart recovery meetings in the community, that people need resources. People need active, up-to-date information on a constant basis. So they really need understanding of what's available to their fingertips. We need to be transparent. What the T of ethos, of our motto of ethos and our treatment is transparency. And as us as leaders in our community, we need to be transparent with our clients and share with them, you know, the activeness that we have to recalibrate our own resources and really pressure, I'm stuck on the word pressure today, to put up an importance, I guess, in our work to make sure that we're actively connecting to more and more information about self-care. So self-care and resources and understanding what's available to us. The other thought you brought up was this idea of technology is with social media. For a long time, I was known for the guy that would talk about the importance of watching out for social media because of this thing called FOMO. We're still experiencing it. We're still seeing it. And how many of you were at home early in the pandemic seeing everybody cook or bake or learn all these great things or workouts, and you would sit and compare yourself to other people's outsides? We're still experiencing that through the pandemic of a little bit of FOMO, fear of missing out for those people that aren't available to adolescent world treatment. So FOMO is a real thing that as clinicians and our clients are up against. If they feel like in social media, no one's posting, I stayed in on a Friday night and ate frozen yogurt and watched another Netflix series. No one's posting stories of how they felt about their insides. They're only posting that perfect image, that perfect branded image of what they want their families to represent in the community. And so it's a little not telling of the real world out there. So we have to reconfigure our expectations of social media. We really have to talk about social media with our clients and really recalibrate the expectations of what are really people really doing out there, how are they really feeling about themselves, and what is other family members or individuals' self-care. Because again, if we really try to compete with or keep up with other people's outsides, people's low self-esteem and their depressive and their anxiety, oh my gosh, how are they looking good so much all the time, is such a major challenge. Another piece and another funny quick story I wanted to mention is how many people on the call would watch The Office. Do you know that The Office was the most downloaded Netflix series of all times in this pandemic? And why would people keep watching The Office? From a psychological standpoint, it's that repetitive show, the known show gave us a sense of calmness. You knew the story, you knew the storyline, you knew where it was going to go, you know where the jokes would land sometimes. And people be like, why would you watch a show again and again and again? So many people in our worlds felt comfort in the storyline, felt comfort in the process, felt comfort in jumping into an episode and knowing that story is so vital. So that idea is The Office was a weird way to kind of bridge resourcing, and redefining resourcing is Netflix. Like, who would, as a therapist, I would never talk about social media or Netflix as an actual resource, but it's how we view it again and what we're looking at it as again, and how we're seeing ourselves in this process. So going back to the slide right before, what about you? I really appreciated, Dr. Roberts, the way you described ABCs, that first piece, of that sense of awareness of self and others. And I just want to take 2 more seconds on awareness of self and others, being aware of your own body, being aware of how much you can tolerate. And for me as a clinician, I used to go back to back. A lot of people know me that I would fit in so many clients in a day and go back to back. Now I'm building in 15-minute breaks between clients. Now I'm building a half an hour after a group or 15 minutes before a group, so I can take an extra time and go for that walk. There are clients, executives that I work with that don't want to be on a Zoom call with me, that they'll get on a phone call with me, they'll pick up their phone, they'll put in earbuds, I'll put in earbuds, and I'll walk around the building, and I'll walk outside. I have a clinician, Grace Ann Flannery, somebody may know her on this call. She walks with clients, and she'll be on a call, and she'll be walking around the neighborhood while working with a client. And it's just a simple telehealth call. And sometimes just hearing the client's voice and walking through it. And I have one client that I work with that is just sick and tired of staring at a screen all day long. So having that awareness that the client himself is like, I've seen you enough, Mike. I know what you look like. I don't need to see you. In our work, I say, that's great. So he hops on his call, but guess what? I go for a walk too. And so that awareness around my day, that awareness of how much I can tolerate, that awareness of what's really happening, that's an important piece. So I wanted to get back to you. So please take this piece.
One thing I think about when I get to slides like this is those in the audience who have a reaction of, oh yeah, okay, here we're going to hear a little more of self-care and make sure you do this and compassion, fatigue, and resiliency stuff. And my bosses make us do trainings like this, but they don't really honor it when we need it. Yeah, right, I'm really going to tell my boss I need a walk, or I need a 15-minute in between sessions, or I need one less client right now. But what I say to that, I can see that happens all over the place. So I'm right there with you on it. I think, though, what's important in that boundary setting piece on this slide is knowing that you really are responsible for that. So you may wonder what kind of backlash you're going to get, but I would probably bet for a lot of you that the courage that you will display in asserting that to a boss, like, hey, you had me do a self-care webinar, and so right now I'm realizing I need it. I need to have a 15-minute walk right now. You might be wondering, I'm walking around campus or the parking lot, but I need to do that. But asserting the things that you need is part of that boundary setting. And again, it's going to help your boss in the long run because it's going to help you stay invested in your work and stay around longer, right? But that boundary setting, Mike mentioned it earlier about how he puts on his work clothes even if he's at home, right? So maybe for some of you, you don't have a private office at home. And so you're like, I don't even have a door in the loft to close to sit privately. And so maybe you're in your bedroom doing a session because you have family members in the rest of the house. Trying to configure your own way to make sure you separate leaving the office and now entering your bedroom if you are doing work in your bedroom. And that may mean changing your clothes. That may mean changing the coffee cup you're using. That, oh, I use this coffee cup when I'm working, but now I'm using this one because I'm home in my bedroom watching TV. You may need those physical cues for your body and brain to know I have separated from one to another, right? So your brain responds to those, and we have to be really mindful of that. I think a lot of the stuff on this slide, we've actually gone intermittently throughout the session talking about a number of these. So if you move to the slide after the one Mike was just on, just to continue again about taking care of yourself in this pandemic. Mindfulness, already mentioned some of the things there in those bullets. Grounding techniques, what are they? You might hear about them. Some of you might practice them. They're very simple. Simple and easy, I notice, aren't one and the same. I think a lot of stuff we give in treatment is simple, but not easy because people aren't doing it as their routine. Who's taught emotional regulation in 5th grade? Nobody. So we become adults and we need to have therapy experiences help us with that. But grounding techniques are just naming things in your environment, becoming present focused. So it might be naming everything in your office right now that's yellow, or naming everything that's rectangle, or just setting intention to see things in a different way. And so for gratitude, I wanted to go back and just give an example, pandemic related. I had someone point out that, because what I say about gratitude is it doesn't diminish or take away the value or the gravity of the situation just because you have gratitude. They don't have to be mutually exclusive. So we can be going through the pandemic, and for this one individual, the gratitude in all the chaos in their world, their kids were at home, virtual schooling, one family member lost their job, there was stuff all over the place. The gratitude they were able to find was because their kids were virtual learning, that they didn't have to set the alarm as early. They didn't have to drive them to school, pack their lunches the same way, have them get ready the same way in the morning. So their entire family actually got a good hour and a half more of sleep in the morning. What did that do for them? That shifted and impacted their moods with each other throughout the day. Everyone had like a shift in their mood or lack of irritability or less irritability because of the extra sleep. We know how important sleep is, right? So she was able to find a moment of gratitude of something she's experiencing in the pandemic, and not meaning that she doesn't appreciate the loss that people are going through because they've lost a loved one, or the pain that they're going through, or it doesn't diminish that she had to worry about where her food was coming from. It's in the midst of that, I'm able to find a moment of gratitude and to be intentional about the lenses that I put on today. Because I can choose to put on the lenses of the world sucks right now. Things are uncertain and scary, and I can choose to wear those, or I can choose to put the other pair of glasses on. Doesn't mean the rest doesn't exist, but this is what I want to work with today. Right? So I think just, again, keeping some of that in mind and remembering we have to take care of ourselves because we are the vessel that others are using for help. If that's, like a takeaway from my part at least, we have to, because we, as clinicians in here in some way, if they're using us for help, we're that vessel. We have to be kind to ourselves. We have to take care of our needs.
And to Dr. Roberts, to your last point, that idea that recovery is a proactive stance. And so I want to end on that last slide of that redefining resiliency. And to your point, the idea of recovery is a proactive stance, and we have to take a participation in, and a real active participation in our own journey of self-help and self-recovery for our clients and ourselves and our families. But redefining what resiliency means, resiliency, that act of being able to get through and come through this past year. And as we're coming up on this year, I want to end on a couple notes. As we're coming up on this year anniversary that we've all been under, I think some of our clients and some of our clinicians are going to be popped with that expectation of a year ago, just like we have anniversaries, in recovery and death anniversaries and loss anniversaries. Some of us are going to look back on this lost year. Some of us have lost years of seeing loved ones, seeing ones that were cared about. Some of our families have senior year, freshman year of college. So many kids have lost their ability to connect and have that normalcy. So again, understanding that this lost year and coming up on this year anniversary is a big deal. And so what I challenge our clinicians and challenge our folks to think about it is like this. And I want to go back to that recovery language of faith. That idea is that we see clients come in every day, come into treatment at Caron, come to us at Ethos, they get clean and sober, they change their lives, and they take on a whole new meaning. And just like that parallel process, the families do as well. And I know some parents are on this call as well. And that idea the parent and family member can change despite having a substance abuse and mental health issue. But we have to look at it in increments and take it to that place of what early recovery meant, like a huge adjustment period in the first 30, 60, 90 days. And that's what we went through in March. And then that early recovery, that first, what is early recovery? 6 months to 24 months. We're going to still see the impact of this past year in our work and our relationships and how we're dealing with others. So no, we're still in it. And we have to redefine our expectations of self and others, and a radical acceptance of self of others, and utilizing that faith of looking back at our own work careers, looking back at our own individual processes of what we face in our lives. So a little bit different of a version of what Dr. Roberts said about a list of gratitude in the day. What I challenged people to look back in the strength of their own work history to see what they faced, how they faced it, and what they've overcome already before we've all faced this, collective trauma called COVID-19. So I want to thank Caron again. I know that Julie has a couple slides, and then we will come back with questions and answers, and we'll try to squeeze that in at the end. So thank you, Dr. Roberts, for all your work today. Julie, do you want to take it over?
Yes, absolutely. Thank you, Michael and Dr. Roberts. We will now continue with questions received through the Q&A. Luckily, a lot of these questions were answered in real time. So one that is still out there is, could you speak to the spiritual impact of trauma and other difficult life circumstances? How do you help individuals who believe the world, universe, and God have wronged them or doesn't support them?
So that's a big one. I've seen a lot of times in my outpatient practice and the work at Ethos, a lot of times people have that cognitive schema where they kind of take on that whole negative view. And a lot of times it's chipping away and seeing, what practical things have clients shown up to. So it's looking for what Dr. Roberts referred to as the little wins, the little positive traits, that they're showing up to treatment, they're showing up to therapy, they're showing up to your individual session, and looking at that as a win, and then trying to build upon those little wins to collectively step back and, again, get out of that collective trauma of everything negative, but to really look at it as breaking it apart to see what other positive traits are happening in the day-to-day existence. That's a great question, though. And Dr. Roberts, do you want to expand on that, or? You're muted.
Oh, what? I think you hit it right on there. I see it's very common. We hear about that as well. And it's just really, again, trying to be very intentional in terms of that meaning making and finding those little bits and challenging that.
Great. Well, we are coming up on our time, so I want to thank you again, Michael and Dr. Roberts, for sharing their insights with us for today, and for all of the attendees for joining us. As a reminder, we are offering 1.5 continuing education credits for today's presentation. Please watch your email for a link to the evaluation from cego.com. You will receive a certificate of completion immediately once you finish the evaluation. Please watch your email for additional webinar opportunities from Caron Treatment Centers coming in March. You may also visit caron.org/webinars at any time. Please reach out to your local regional resource director at any time for additional information, resources in your area, or question regarding admission to any of Caron's programs. Thank you for joining us, and have a great afternoon.